study I will be speaking on the topic serum vitamin D levels, alternation patients with retinal vasculitis.
Just bring the mic a little close.
Introduction. Retinal vasculitis is a group of retinal diseases that can cause severe vision loss in patients in the middle age and elderly population, but no age group is immune to it. The retinal vasculitis includes diseases of both retinal artery and vein such as CRAO, BRAO, CRVO, HCRVO and PRVO. The incidence of CRO is reported to be range from 1 to 8 per lakh population. BRO is total than 38 of the acute arterial occlusion. CRO accounts for around 0.4% and non-perfuse CRVO is the one which demonstrates more than 10 this area of retinal capillary non-perfusion on angiography. BRPO have incidence of 2.3. The ischemic BRPO is defined as on frozen angiography as area with greater than 5 disc diameter of non-perfusion. Now the main objective of my study was primary. It was to estimate serum vitamin D levels in patients with retinal vascular occlusion and compare it with age and sex matched healthy controls. Secondary aim was to determine whether there is a difference in serum vitamin D levels between ischemic and non-ischemic subtype of retinal vascular occlusion. With this, the purpose of the study was actually there is no study available in the literature which has analyzed serum vitamin D levels in all type of vascular occlusion, including those with retinal arterial involvement. This knowledge gap, we formulated our study to analyze serum vitamin D levels in patients with all type of retinal vascular occlusion and compare whether there is a significant difference between serum vitamin D levels in ischemic and non-ischemic retinal vascular occlusions. A method was used. The serum vitamin D levels analysis of patient with retinal vascular occlusion who was reported over OPD was done and compared with age and sex matched healthy controls not having RBO disease from general population. All patients in study and control group was analyzed for fasting blood levels of vitamin D using the VIDAS. We have taken the following normal levels of vitamin D as more than 30 nanogram per ml. Levels in between 20 and 30 was taken as vitamin D insufficiency. Levels less than 20 was taken as deficiency. And the patient with RBO was categorized into ischemic if there is presence of neovascularization. The inclusion criteria of our study was all patients diagnosed with RBO with age more than 18 years. All cases of retinal vascular occlusion clinically diagnosed by our ophthalmic department at AIOCMT3 Pune. 50 patients with any observable occluded disease which was age and sex matched were included in the group. Total there were 50 RBO cases and 50 control cases. Our exclusion criteria was age of patient less than 18 years, patient with concurrent retinal diseases which were likely to present with capillary non-perfusion and neovascularization like diabetic retinopathy, retinal vasculitis and hypertensive retinopathy. Patient already on calcium and vitamin D supplements were excluded. Alcoholic cases, renal and hepatic disease were also excluded. This was the result in 50 cases of patients. There was 30 cases of CRPO, there were 30 cases of BRPO and there were 2 cases of BRPO respectively. In age and sex match there were 32 males and 18 was female in the patient group as compared to 33 in male and 77 in the control group. The mean age of our patient was 62 in the control group and 16 patient group. In patient group 36 had serum vitamin D deficiency out of which 20 were male and 11 were female. But there were no statistically different association found between sex and serum vitamin D levels. Serum vitamin D values in control and patient group. Here in the patient group we found a very less serum vitamin D level as compared to the control group. The difference in the mean vitamin D level between the two groups are found to be statistically significant. Vitamin D levels in RBO group, in the patient group we have the less vitamin level as shown in the picture. There was in the patients, 72 patients have deficiency as compared to the control where we have the 20% of the cases. Among all 36 cases of vitamin D deficiency, there were 12 cases of CRPO, 18 of BRBO and 4 cases of CRO and 2 cases of BRO. On FFA, 70 cases in the patient group found to be ischemic. The difference in the baseline BCA between the two subgroups were found to be statistically significant. In ischemic case and non-ischemic vascular occlusion versus vitamin D, among 13 cases of CRPO, the ischemic cases have less vitamin D level as compared to the non-ischemic cases, subsequently in the other groups also. And the difference in the vitamin D level between the ischemic and non-ischemic subgroup were found to be statistically significant. This is a chart which clearly shows in ischemic cases the vitamin D level is significantly low as compared to the non-ischemic cases. Though this was a limitation of my study since it was a small sample size. It was a case control study which provides only one-time data frame. Hence, long-term effects can be elicited. It was a single center study. More centers need to be included in this study. Discussion: the mean serum vitamin D level in our patient group was found to be 18 as compared to the control group which found to be 32. This study was first time determining the vitamin D level in whole spectrum of fractional vascular occlusion, including arterial as well as venous. This was not done previously in the published literature. Conclusion: the significant vitamin D levels in various subtypes of vascular occlusion in comparison with age and sex by controls points towards a probable role of vitamin D deficiency in pathophysiology in all types of vascular occlusion. In addition to it, the serum vitamin D level was found to be more significantly lower in ischemic cases as compared to the non-ischemic cases. These cases need to be monitored more aggressively, and vitamin D supplement may be considered as a possible future medication decreasing the severity of the disease. Thank you, ma'am.
You want to stress that vitamin D deficiency is associated with ischemia.
That's overall the main.
That is why it is effective in all ischemic diseases,
Yes.
retinopathy,
Yes, sir.
when given all plethora of
Yes,
diseases.
but I have gone through the literature, the biggest study like Rotterdam study.
Why specifically about CRV? I think it is effective for all ischemic diseases. Anything specific about CRV?
So we have taken actual cases of RVO. The main what I have gone through the literature of a big study like Rotterdam study, Oli et al. And Epstein et al. What they have done the study.
मेरे कहने का मतलब है ना कि हर इस्कीमिया में विटामिन डी की
Yes, sir.
यूजफुलनेस है.
Yes, sir.
आपके स्टडी में भी you have shown that ischemic CRVO में it is more deficient.
Yes, sir. Statistically, yes, sir.
I'm telling you, it's only specific for a CRV or it is unspecific, non-specific.
So
It's true for any ischemic retinal disease.
it's true for everyone.
Thank you.